All right, well, Australia's medical regulator is cracking down on cosmetic surgery. Over the last decade, botched procedures have been on the rise. The industry responsible for causing permanent damage to countless Aussies.
To discuss, we're joined by today health expert Dr. Nick Coatsworth. Doctor, good morning to you.
Good morning to you both.
So what is changing? What do I need to be careful of?
What do you need to... You don't have work, Carl. Come on.
No,
tell us.
Whatever gets you through the
Look
night.
at it.
Whatever
Look at
gets you
it.
through the night.
Look, I think the main thing is that you've got to go to a reputable provider of cosmetic surgery, and so many disreputable providers have emerged over the past decade or two. And I think some of the responsibility has to lay with the regulator here. I mean, it's not as though these fillers and things have turned up overnight. They've been around for a while, but it's 2023 and we've only just got the regulations.
Is that going to make a difference, though, do you think, that if people do follow the guidelines? Because we know there's such a proliferation of these services available out there. As you said, you've got to find the right one for you. The guidelines, will they help?
They will. They're quite detailed. You can go to www.health.gov.au, cosmetic surgery. My former employer, the health department, has actually put some really good questions out there that consumers can ask. Now, practitioners have to be licensed, the facility has to be licensed with the Australian Council of Healthcare Standards, all those sort of things are important. And the new thing in the past 24 hours is, of course, this doesn't just apply to medical practitioners, it's now nurses, it's now nurse practitioners, even dentists that I know are getting in and getting a bit of bobo as a way of probably making a little bit more cash, to be honest. But, you know, all these people need to be regulated and the consumer needs to be empowered to go to the right person so you don't end up with a disfiguring infection after your Botox.
After your bobo, as you like to call it. Otherwise you have to go
Isn't
to
that what you call it?
Bobo, is that what the cool kids call it? No.
Yeah. Oh, well,
We'll
yeah.
go with it. We'll go
Otherwise
with
you have to go to the popo. Look, September means the start of hay fever season as well.
It does.
Already I can feel it starting to well up.
Well, you can hear it in me this morning.
yeah.
I've got it, yeah. Now, it's always a difficult thing to sort of control, the hay fever, and particularly in the post-COVID period. I was sitting next to a fella on the plane last night and he's sneezing away. I'm thinking, oh, I'm going to get COVID. So you really want to control your symptoms, and you can do that through a lot of over-the-counter medications. Antihistamines, nasal steroid. The trick with the nasal steroids over the counter, guys, is that you want to keep going for 2 weeks. Often people start using the nasal steroid, it won't work after a couple of days, they'll put it away. And I think that's the real tip from today. Persist with the treatment. You're not going to have anything happen overnight, but it will happen in a couple of weeks.
Other than locking yourself up, is there any more permanent thing we can do?
Look, some people get real problems with hay fever despite everything they do from the pharmacist, and you can actually get allergen desensitisation in the form of pills. So if you've got a grass pollen allergy, you take pills prescribed by an immunologist that have ever-increasing doses of the grass pollen, and that actually stops your immune system from reacting. So if it's really tough for you, that's the direction you have to go down.
It's just a pill for everything these days, isn't it?
There is a pill for everything.
Good on you, Doc. Nice to see you, mate.
Thanks,
Good luck with the bobo today.
Hey there, Today fans. Sarah and...
What's my name again?
Oh my God, Carl.
Hey, thanks for watching our YouTube channel, though. Subscribe now for more news, special reports and amazing Aussie stories.
And Carl misbehaving,
Whoa,
of course.
that never happens.
Always happens.
What's she talking about?